For my virtual reality project, I decided that I wanted to focus on its therapeutic uses, both physically and mentally. As I began to study this topic more closely, the advantages, such as finding coping mechanisms for those with mental illnesses, seemed to outweigh the disadvantages, like its side effects. As I said, there are both the mental and physical sides of virtual reality therapy. Looking at the mental side, helping therapists to find coping mechanisms for their patients as they suffer from anxiety, depression, phobias, psychosis, or PTSD is a key aspect. For the physical side, virtual reality could be used as a form of pain distraction, and there have even been studies done using it as a form of physical therapy for those recovering from traumatic brain injuries. Sparks targeted young adolescents that suffered from depression. After users were placed in their 3D environment to complete puzzles and challenges, results showed that the program led to improved mood and increased levels of hope for their patients. Dr. Louise Peeling interviewed Lucia Valmagia, a clinical psychologist and researcher at King's College Hospital in London who has her own virtual reality lab. This interview displayed the benefits that a 3D environment would have for someone who suffered from anxiety or psychosis. Alika Agidi Jeff happens to be someone who does, and he tested out Valmagia's virtual reality lab himself. After being submitted into environments that triggered him specifically, he agreed that virtual reality could help illnesses from getting too out of control while in its early stages. And for those who were further along, like himself, it would help them to learn coping mechanisms for when they were experiencing their anxiety. Albert Skip Rizzo, who is the director for medical virtual reality at the University of Southern California's Institute for Creative Technologies, had an interview with Audrey Hamilton where he discussed life improvement through virtual reality therapy. He discussed both the mental and physical aspects. On the mental side, he said that exposure therapy was the main goal of virtual reality in order to help people process their fear environment. According to Extinction Learning, which states that facing your fears allows you to see them as less frightening, being exposed to a phobia in a 3D environment would help to diminish that fear entirely. Rizzo also discussed the physical side of virtual reality therapy, using it as a form of pain distraction. He used the example of a burn victim getting their daily wound care, but being able to play a virtual reality game to help to take their mind off of the pain that they were feeling. I also looked at a study that discussed the physical therapy after a traumatic brain injury. Studies show that the more time a patient dedicates to therapy with functional goals in mind, like performing a certain motion in a game, the stronger the synapses and faster reorganization of the brain can be achieved. Honestly, I couldn't find that many dangers in this field and none that were real-life examples. The only dangers that I can report are those displayed in fictional worlds like the episode playtest in the Black Mirror series. Being submitted into a virtual reality environment for too long could lead to the patient's real time becoming distorted, and they could also become dependent upon that environment. With this, though, their time in their 3D environment would be monitored by their therapist, therefore I do not believe that this would be too much of a concern. A few other dangers include the patient's loss of spatial awareness as they are in their environment, feelings of dizziness and distortion if submitted for too long, nausea due to seeing movement but not actually being able to feel it, seizures for those who are prone, and eye irritation from staring at a screen for too long. All of these dangers, though, are just like any other side effects you would see for any other type of medical treatment or procedure. Therefore, the patient would just need to understand that there is a chance that they could experience this, and they would just need to decide if the positives outweigh the negatives for them personally. Overall, my focus on this project is mainly on the physical and mental aspect of virtual reality therapy. I looked at research and studies that concentrated on mental illnesses like depression, anxiety, psychosis, phobias, and PTSD. I also looked at the more physical side of things, where I found that virtual reality could be used as a form of pain distraction and even as a form of recovery for those who suffered from a traumatic brain injury. After doing this paper, it is clear that there are far more advantages to this method than dangers, seeing as I was unable to find any instances where patients had an unpleasant experience with their virtual reality therapy.